Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. October is National Breast Cancer Awareness Month. From Susan G. Komen to countless other organizations and individuals, pink is the color we all know this month. In today's episode, I'm diving into the impact of breast cancer on aging with my fellow OT and entrepreneur, Zera M. Zera. Zera has been working as an occupational therapist since 2002. She has worked in a variety of settings, including skilled nursing, inpatient and outpatient rehab, and academia. Growing up, two of Zera's primary caregivers were people with disabilities. Her upbringing provided her with firsthand knowledge of what is possible when living with a disability. These experiences also revealed the many barriers people with disabilities face on a daily basis. Throughout her personal experience and her career, Zera observed the gaps in rehab and recognized opportunities to improve client outcomes. In 2013, Zera returned to school to study the most effective approaches to help her clients return to their most life-affirming activities. This experience propelled her to start Moxie OT. Moxie OT seeks to support occupational therapy consumers and practitioners in developing the confidence they need to reach their goals. Moxie OT provides mobile occupational therapy in Chicago and online educational resources for occupational therapy practitioners. The Moxie OT Podcast is a place for occupational therapy practitioners, consumers of occupational therapy, and friends of occupational therapy to talk about evidence-based occupational therapy for adults. Learning from other experiences is an important part of growing as an occupational therapist. The Moxie OT Podcast is created to help occupational therapy practitioners to increase their Moxie. Together, we're taking a dive into breast cancer facts and figures, testing, intervention, and beyond. Please join me in welcoming Zera to the show. Zera, thank you so much for joining me today.
I'm excited for this conversation.
Me too. So I gave a brief intro bio about you already, but I want to hear more about your journey in OT and your experience in working with the cancer population.
Yeah, thanks for asking. So I started my career in skilled nursing, and when you're working with older adults, they always have comorbidities. They have a long medical history. They've been on this earth for a long time, and sometimes as a new grad, I didn't always feel prepared to work with folks whose medical history or medical needs were so complex. And I always think about this one client that I had. She had severe lymphedema, which is a swelling that you can get in your arms or your legs, often caused by cancer surgery. There's other causes too, but so she had this swelling in her arm, and then her arm was paralyzed from a stroke. And I was just so ill-equipped to manage that whole situation, and I really gave it everything that I had, but it didn't really facilitate a lasting change. So that was where I sort of started to learn, I need to learn more about how I can support these folks that I'm working with, and specifically ones that have or had cancer. And then later in my career, I was working in what we call an outpatient day rehab setting, and most of my clients had neurological impairments and, again, very complex needs. And at one time we were told, well, we're starting a cancer program. And what this meant was that the hospital had hired a rehab doctor that was focused on cancer, but it didn't mean that we got any additional training as therapists. So Again, I know one of my early cancer clients, she had an aggressive form of brain cancer. And again, I didn't have the skills required for that case. Clients like that have a rapidly changing need, and I needed to learn to change how I approached clients with cancer and how different cancers might impact the outcomes differently. So since that time, I've taken a lot more continuing education courses. I've improved my skills for working with clients with cancers. I know how to set goals that are appropriate. I know how to understand what the outcomes can be expected to be and how to better communicate with the team. And I was really excited. I got to take a lymphedema certification course. So for those folks that have that swelling that I was describing, I have the skills to decrease their swelling and prepare them to manage that over time. And then I also have gotten to take some courses to address cognitive changes, because I don't think a lot of people realize that chemotherapy or some of the other treatments for cancer can actually cause cognitive changes. And OT is actually a really great resource to help folks with those changes. So learned a lot over my career.
Yeah, that's great. I love how you looked into things that you didn't quite know much about and then took that on as like a learning opportunity so you could serve your clients better.
Yeah, lifelong learners, right?
Yeah, for sure.
So what about you? What's been your experience with this population?
So my very first experience with oncology was when I was only 18 and my grandfather was diagnosed with esophageal cancer. So that was like my first real personal experience with like, okay, this is what cancer could be like. And then of course that later spread to his lungs. And so I got to experience a lot of his treatments between chemo and radiation. And I also saw the impact on his general health and mood and kind of just progressive decline over time. Professionally, I worked at a major trauma one hospital when their medicine and oncology departments were both under one therapy coverage team. So I was kind of like the lead OT that was covering the med-onc service. And it was both of those areas combined. And during that time, I was able to treat both acute and chronic cancer patients. So acute meaning they were newly diagnosed or diagnosed and like getting treatment actively. And then chronic was more so those who have had treatment and still have the cancer, or they've had treatment and they're in remission. And so I got to kind of see a wide spectrum of cancer patients throughout their treatment and recovery period. When I moved here, the hospital I've been at has the medicine and oncology team split. So I no longer worked with the population as much while they were receiving their treatment, but similar to my previous experience, a lot of the patients on general medicine have an oncological history. So kind of like what you were saying, a lot of our medicine patients, older patients, have a lot of comorbidities, and very frequently on general medicine, a lot of these patients have some sort of cancer history. And so you get to kind of see the different impact on their overall health and wellness as they're older.
Yeah, I think that's one important thing for us to remember as OTs is even if we're not seeing folks with cancer, we're probably going to see some of the impacts of cancer in our clients at some phase in their life.
Yeah, absolutely. So I know we have a lot of good specific questions coming up that we're going to ask each other, but I want to provide a brief background on our topic today and a general disclaimer. So although the theme of this topic today is based on Breast Cancer Awareness Month, we will be providing some information that is relevant to any cancer and any type of cancer treatment in general. According to the CDC, breast cancer is the second most common cancer among women in the United States, with the most common being certain types of skin cancers. Approximately 240,000 women and 2,100 men are diagnosed each year, and about 42,000 women and 500 men lose their battle each year. Black women have a higher rate of death from breast cancer than all other women, and it is the leading cause of cancer death among Hispanic women. Although deaths from breast cancer have declined significantly over time, largely due to preventative testing and early intervention, breast cancer remains to be the second leading cause of cancer death among women overall. When we're talking about older adults, it's important to note that the median age of a breast cancer diagnosis is 62, and nearly 20% of women diagnosed with breast cancer are over the age of 75. Women over 70 have a 1 in 24 chance of developing breast cancer at some point in their lives.
Wow, thanks for sharing that, Pooja. I really had no idea just how prevalent breast cancer was. That's pretty eye-opening.
It is. I feel like we used to hear a lot more about it back in the day. And I say back in the day, like maybe 10 years ago, but I feel like maybe it was just because when I was in college, like there was always a lot of stuff that happened in October for Breast Cancer Awareness Month. I mean, everything was pink, right? There was a lot of awareness around it. I think there used to be so much awareness about it, and I feel like people talked about it a lot. And over time, I feel like, I don't know, I personally thought that it wasn't as not dangerous, I guess, but like people didn't die from breast cancer as much anymore. Like I feel like I hear people getting breast cancer, and I'm like, well, if it's detected early enough, it's treatable.
Right.
You know?
Right. And we'll get into some of that later, that it needs to be detected early enough. What are some of the common physical, emotional, and cognitive changes that older adults with breast cancer might experience during and after treatment?
From my experience working with them, usually during treatment, there are quite a few changes that they can experience. So we often see a change in like physical strength and endurance as a side effect, which can drastically increase someone's risk for falling. Similarly, there is often an impact on cognitive functions, like you mentioned, such as delayed processing, feeling fuzzy, or what is poorly but more often known as chemo brain, and a general decreased attention, which can lead to decreased independence overall from a safety standpoint. Emotionally, it varies from person to person. I've seen a whole range from deep anxiety and depression to acceptance and gratitude. Everyone has the right to feel how they feel about the cards they've been dealt, but I will say I've seen more patients with less emotional impact when they have a strong support system, because it helps relieve some of their stress and burden of whatever else they might be thinking about or worrying about outside of just taking care of themselves. Specifically with breast cancer, depending on what form of treatment they've received, there may be a variety of challenges that arise. So for example, if they get a mastectomy, which is a removal of a breast, then the involved arm may experience some dysfunction such as like decreased range of motion, decreased strength, pain, anything with like using the arm on the side of the breast that is removed. Mm-hmm. The greatest risk here, from my understanding, is the risk of contracture development, which is when the muscles not being used tighten over time, which then makes it impossible for the person to move the arm later on. I kind of explain it like a rubber band. So if you have a rubber band, if you use it often as it's intended, it maintains its elasticity for quite a while. If you overuse it or overstretch it, it breaks. If you don't use it as much or ever, and it's just sitting in your junk drawer, it gets really hard over time. And then if you try to pull on it or tug on it, it usually doesn't move. And so that's kind of how our muscles work too. And so you have to kind of keep moving them over time. Otherwise, they lose that elasticity that they have. I think after treatment, it's more so the chronic fatigue that I've had many people report. For some people, the fuzziness in their cognition tends to last a bit longer too. Or for some, it could even turn chronic. For post-mastectomy patients, I've sometimes seen a permanent disability in the involved arm, which is often a result of poor early intervention with range of motion and strengthening.
Yeah, really important to keep moving as much as your doctor allows you to. And I love how you mentioned the importance of a support system. You know, I think our friends and our family are a really important part of our support system, but I just like to remind folks that there's lots of supports in the community too. So here in Chicago, where you and I live, we have Gilda's Club, which is an amazing, I call it a support group and more. Like they have support groups, but they have yoga and cooking classes, and their calendar is just full of events. So that's an option for folks, or maybe within your religious community or your social club, there's people out there that want to support you and help you. And I like to remind folks of that too.
Yeah, those are some great examples of how the community can support people too.
Yeah.
I think we've both touched on this a little bit already, but more specifically, how does breast cancer impact the overall well-being and quality of life of aging individuals, and what specific challenges do they face compared to younger patients?
Yeah, I think that's a great question because, you know, kind of like in the way your statistics sort of blew my mind at the beginning, I don't think we always think about how cancer can impact older adults. And Cancer is now considered a chronic disease because more people are living with cancer, living many years in remission, or facing complications as they age. Our aging bodies have a reduced tolerance to aggressive cancer treatments like chemotherapy or radiation, so that might lead to an increased risk of treatment-related side effects or a greater impact of those side effects. If you have surgery for breast cancer, like a mastectomy or even a lumpectomy, it can take an older adult longer to recover from the anesthesia. And then because of the greater impact of the anesthesia, older individuals might be more likely to experience some of those cognitive changes because of the anesthesia or from chemotherapy. And that can impact your ability to understand and make decisions about your treatment options, can make daily activities more challenging, like paying your bills or planning and organizing your day, or even following complex directions like a complex recipe. And as you mentioned earlier, breast cancer impacts your physical function and mobility, particularly of the affected arm. And that can be more challenging for older clients who might already have some age-related mobility issues in their shoulder. Because you might be limited in how much you can move your arm immediately after surgery, the older you are, it might be more challenging to regain that mobility after that time of immobilization. So then, you might have trouble reaching into your cabinets or your closets and brushing your hair and all the things we do in the day when we raise our arms. So, and then, some of those comorbidities that come with aging can impact that as well, right? So if your arm is weaker because you had a stroke or because you have an older shoulder injury, that's going to impact that arm's recovery as well. And then the last one I always think about is fatigue. And I know you mentioned this earlier too. I think that's one of the more common side effects of cancer treatment. And I think older individuals may experience a prolonged recovery time. And, they might experience challenges keeping up with their family or caring for their home or just having the energy to do the things they need to do and want to do in a day.
Yeah, I love that you mentioned the anesthesia piece of it. So a lot of times I've noticed that, the older adults in the hospital, when they're receiving general anesthesia, it's always a list item on my assessment of making sure, like, checking in on their cognition, because if they've had general anesthesia, they're more likely to have more long-term effects or just a longer time getting out of it than somebody who might be a lot younger.
Yes, and I love to hear that an OT is checking in on their cognition, because I feel we are very well equipped to identify those changes and help folks address those changes. Pooja, I was wondering about, for individuals who are in remission from breast cancer, what are some potential long-term effects they might face as they continue to age, and how can OT assist them in managing those effects?
I think, like I mentioned earlier, for those in remission following treatment, I think it's more so the chronic fatigue and the fuzziness in their cognition that tend to be the most prominent long-term effects. So for chronic fatigue, occupational therapy practitioners can educate on things like activity modifications, energy conservation, pacing strategies, as well as help integrate all of that into like new daily routines, right? Routines are something that we do very strongly in OT, but it's also what everybody lives by every day. And so sometimes incorporating just changes in your day-to-day routine can help manage that chronic fatigue a lot better. For cognition, occupational therapy can help with some cognitive retraining or rehab if it appears to be beneficial. So depending on the cause of the cognitive changes, retraining and rehab might be appropriate. In certain cases, if it's going to be more long-term and becoming chronic, then occupational therapy can assist with compensatory strategies and environmental modifications that would support some of those needs in their home.
Yeah, I love that. And I totally agree with you. I don't think other medical providers, and this means that we as OTs need to do a better job of advocating, but I don't think folks realize how beneficial OT can be for folks with chronic symptoms. And over the past, 5 or 10 years, OTs have done a lot of research on self-management of chronic diseases. And we have a lot of tools in our toolbox to help folks manage those symptoms and continue to live a high quality of life.
Yeah, absolutely. I definitely think we don't work at the top of our license in most settings is how I kind of phrase it.
Mm-hmm.
You know, there's so much value that we can bring to our patients and clients in so many different settings. And a lot of times we get siloed into these buckets of like, okay, OT is going to do this, PT is going to do this, speech is going to do this. And it's like, okay, that's cool. We'll make sure we check off those bucket items, but let's also factor in everything else that we have at our disposal as an OT to make sure that we're providing the best services and options for our patients.
Absolutely.
Zera, how can occupational therapy practitioners play a crucial role in supporting older adults with breast cancer, whether they are in active treatment or in remission?
Yeah, and I think we've been starting to get into this. One of the things that I think it's important for folks to know is that occupational therapists always provide an individualized assessment. So while breast cancer and the side effects of treatment may impact people in different ways, your OT is always going to spend some time getting to know you and identifying what your specific needs are and what your goals are. And that being said, as we already mentioned, one of the most common side effects of cancer is that cancer-related fatigue. And OTs work with clients with fatigue to help them develop habits and routines to maintain their energy level and conserve energy for the activities in their day that are most important to them. We help folks think about how they want to spend their time and energy and develop those strategies to do just that. So sometimes that might mean taking breaks throughout your day or spreading out important activities throughout the week. We might help you prioritize what's most important to you. So it might be worth asking your spouse to make dinner so you have the energy to play with your grandchildren. Could be one example. Another thing that you and I have both been talking about a lot is addressing those cognitive changes, whether that's because you're in active treatment or this is more of a long-term chronic cognitive change. And people might notice they're becoming more disorganized, having trouble remembering things or concentrating. That has a huge impact on your day-to-day life. So OT can help you develop strategies to manage those symptoms. In my practice, I like to teach my clients what I call a global cognitive strategy, which is called goal, plan, do, check. And you can apply that strategy to almost any problem, right? So if your problem is that you're disorganized paying your bills, you might create a goal that you're going to pay your bills on time. And your plan might be, I'm going to write all of my bills on a calendar. Or maybe my plan is I'm going to set auto pay up through my bank. And then you have a check to know if your plan worked. And so in this case, it might be when you go in and check your accounts, all your bills were paid on time. Or it might be you just didn't receive any of those second notices. So that's kind of an example of what an OT session can kind of look like. And then, like I mentioned at the top, or some OTs are also lymphedema trained, so we can help with that swelling in the arm. And I think what's really important is to know is that lymphedema or that swelling requires long-term maintenance. Often people wear a compression garment during the day and a different one at night. And sometimes as we age, it can be challenging to put those garments on. So OTs can not only help with the swelling, but help problem solve how to manage those symptoms long term and maybe even adapt those strategies as your body changes. So that was a lot.
Oh, great. I think that really covered a lot of different areas. And I love that you gave specific examples to not just our audience who might be listening, but even to like other OTs who can then maybe get ideas on different strategies that they can use.
Yeah, I hope so. So I know we've talked a lot about during and after treatment, but are there any actions that can be taken pre-treatment? Like what preventative methods are there for treatment side effects or for breast cancer itself?
Great question, Zera. I feel like we live in a very reactive world, and sometimes we forget that there's a whole proactive side of healthcare that never really sees the light of day. And that's something that's super close to my heart, prevention and proactive care. And so thank you. So my most common pre-treatment and during treatment experience with acute cancer patients has been largely related to strength, activity tolerance, energy conservation, fall prevention, and early education. What I mean by that is if you know that you're going to be starting treatment, start building up your strength and endurance from the beginning, right? You know it's going to take a toll. All the research shows that in most people who undergo cancer treatment of any sort, they are likely to become deconditioned. They're likely to lose some energy. And so it's really important to kind of start working on improving that from the initial stages and then continuing that throughout treatment. So what that could look like is maybe you start a 10-minute walking routine every day, right? Maybe you do it twice a day and you start doing that leading up to treatment. And then even during treatment, every day, just get yourself up and do that 10-minute walk once or twice a day that you've already conditioned yourself to start doing. Other things could be energy conservation. So you kind of mentioned some of those pacing strategies, breaking tasks up throughout the day. A big one that I like to mention always is if you're doing stuff and standing like most people do, sit down and do it. See what you can do just by sitting down. The amount of energy you might save from sitting versus standing can be the difference of you being able to hang out with your grandkids later that day. And so really trying to plan ahead and make sure that you have enough energy and strength to do the stuff that is truly meaningful to you. And then early education is more so understanding the possible side effects of treatment from a functional and cognitive and emotional status, and understanding that, it's not going to be linear. It's going to be likely a roller coaster, and trying to figure out how you're going to manage that, whether it's from support of healthcare professionals like ourselves, whether it's support from family, or whether it's support from the community like you mentioned earlier. And just having all that set up and in place so that as you're going through it, it's already all there and you don't have to try figuring it out on your own.
Love that.
Many times I feel like patients have no insight into what to expect, and they don't really have a full understanding of what they're walking into and how that might impact them. And so I think that overall can result in a decreased emotional status and just decreased mental health overall. And then that impacts recovery afterwards, right? Because if you're not set up for success and then the process drains you, recovery is going to be that much harder. And so again, really important to kind of take those proactive approaches there. As far as general prevention goes for breast cancer, the CDC has some general recommendations on how to reduce one's risk for breast cancer. Some of them include maintaining a healthy weight, being physically active, moderate or no alcohol use, and breastfeeding your children if possible. It's also important to know if there is a family history of breast or ovarian cancers or any of the related genes, those could be tested for and managed early depending on the situation. I feel like I say this a lot, but prevention is not always the answer, as some things are inevitable, but early intervention almost always works. And so just knowing that and understanding that, it's not so much preventing it from happening because you might not be able to. It's more so intervening early so that you have a chance at it, fighting it. Mm-hmm. There are also many known risk factors that can increase one's risk of getting breast cancer. So for example, there's known genetic mutations, as I mentioned earlier. There are reproductive history. So there's research that shows if you started menstruating prior to the age of 12 and started menopause after the age of 55, that increases your risk of getting breast cancer. Dense breasts, which means having more connective tissue than fatty tissue. Previous history of breast cancer increases the risk of recurrence. Family history, and then any previous radiation to the chest or breast. So for example, you might have received treatment to your chest or breasts for Hodgkin's lymphoma before the age of 30. If you identify having any of these risk factors, it's important to have those conversations with your doctor regularly to ensure there is an option for early detection and early intervention.
Yeah, that's so important. And I know it can be hard to want to think about those risk factors. I mean, no one really wants to think about getting cancer. I did bring it up with my doctor last year, and we scheduled my first mammogram, and I'm glad I did it because now I'm just on their schedule to get one every year. So I kind of don't have to initiate that myself. It's just kind of in there in my medical record, and they're reminding me to make that appointment. That also made me think about one more issue, which is that many mammograms aren't accessible, which can be harder then to get a mammogram as we age or for folks that are living with disabilities. So one exciting thing is that here in Chicago, Dr. Susan Magacy has been working to decrease the barriers to mammograms. And she's even had events called Screenable at the University of Illinois at Chicago. And those events provide free accessible mammograms. So that's something to kind of look out for if that's been a barrier for you.
I love that there is an OT working on improving access to healthcare. So we talked a lot. We talked a lot about what we do, our role, everything about breast cancer, from testing to treatment to long-term impact. What is one takeaway that we want our audience to consider as it relates to breast cancer or any cancer and its impact on aging?
Yeah, so I really just want folks to be aware that OT can help at all of these stages. I think you and I both had examples of how OT can help at every stage of the game. And our role as OTs is to help people do the things they need to do and want to do. And so from pre-treatment to during treatment to remission, often folks are facing mental and physical challenges that impact their day-to-day function. And that's exactly what OT is here to help you with. We want to help you live the life that you'd like to be living.
That's wonderful, Zera. My strongest emphasis remains on early detection and early intervention. If you keep up with your annual exams, like Zera mentioned, and have regular conversations with your doctors about any concerns, it is exponentially easier to catch something early and therefore hopefully treat it early for better long-term outcomes for you. So don't wait until it gets worse.
Thanks so much for that reminder, Pooja. Yep, schedule those mammograms.
Thank you so much, Zera, for having this conversation with me.
Thank you for having me. This was fabulous.
To all my listeners, thank you for tuning into this week's episode on breast cancer and aging. Sharing expert perspectives on various age-related topics and services can help the community learn how to plan for a healthier future. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.